Assalamu alaikum. I'm Dr. Ida Khan and you are watching Medico's Guide. In this video, we are going to talk about musculoskeletal system. So here in this video, we are going to be discussing about structure, function, as well as assessment of the musculoskeletal system. And for this, we need to have the basic understanding of the structure and function of the musculoskeletal system first. So now let's begin with the structure of musculoskeletal system. Now, as you know that the musculoskeletal system is comprised of various structures. So now let's name those structures. So first of all, when one bone articulates with another bone, it forms a joint. Then the cartilage forms a padding at the end of bones. Then the muscles are attached to the bone with the help of tendon. Then the bones are held together with the help of ligaments. So these are all the structures. And as you know that in muscles we have three types. There are three types of muscles and these are cardiac muscles, smooth muscles and the skeletal muscles. So now the basic differences among them are that the skeletal muscles allow us to perform the voluntary actions while the smooth muscles and the cardiac muscles they perform involuntary actions. Then about striations, so the striations are present in cardiac muscles as well as in the skeletal muscles, but these striations are absent in the smooth muscles. Now let's talk a bit about the structure of bones and muscles. So first of all, we are going to discuss about the structure of bone. Okay, now as you know that the bony tissue or the osseous tissue is made up of two things, and these are the bony cells which are known as osteocytes, and the other thing is extracellular bone matrix. Now in the extracellular bone matrix, there are two components. One is one third organic component and the other one is two third of inorganic component. Now in the organic component, it is mainly made up of collagen, and the collagen is responsible for giving our bones flexibility. So it means that if this component is lacking in our bones, so this can make the bones brittle like chalk. While on the other hand, in the inorganic component, it is mainly made up of calcium, and this is responsible for giving our bones strength and stiffness. So it means that if this component is lacking in our bones would become soft and easy to bend. And the most common condition that is seen is the rickets, and it is found in the childhood due to deficiency of vitamin D. Now let's talk about the structure of muscles. So as you know that muscle tissue is made up of many specialized elongated cells which are known as muscle fibers. And these muscle fibers they are bundled together in order to form a fascicle. So all of these structures they are lined or they are covered by the connective tissue covering. And these coverings are for example, we have epimysium that is around the whole muscle, then we have a perimysium that is around the fascicles, and then we have endomysium that is around each individual muscle fiber. And then these connective tissue coverings basically provide support and protection to each structure. And now all of these connective tissue is continuous with the tendon, and it allows the muscle to be attached to the bone. Now this was all about the structure of the musculoskeletal system. Now let's talk about the function of musculoskeletal system. So the first and most important function of musculoskeletal system is that it provides support to our body. Then the next thing is that it provides movement. And how it provides movement? So it is achieved by the series of steps. And as you know that stimulates or it initiates a movement. How? So CNS first stimulates a muscle, then muscles respond to that stimulation by contraction, and then when muscles contract, so it pulls the bone in the direction of its contraction, and this is how the bones act as a lever. So this is how the movement is produced. Then also the musculoskeletal system assists in a movement by generating kinetic energy by performing fine motor tasks as well as by the shock absorption. Now in our body there are two types of shock absorption. First is the active shock absorption, then we have the passive shock absorption. So in the active shock absorption, it is basically made up of contractile tissue like our muscles. So muscles basically directly respond to the shock and by the contraction. So this is how the active shock absorption takes place. While on the other hand, we have the passive shock absorption, and in this, it basically comprised of non-contractile tissues like the ligaments, we have the cartilages, and all of these structures they basically act as a buffer in order to minimize the forces, loads on our bones and on our joints. Now, the other function is that the musculoskeletal system provides protection. So, basically, this system acts as a barrier to provide protection to the internal vital organs from the impulsive forces. And the example of this is that our skull provides protection to brain, our spine provides protection to spinal cord, our ribs provide protection to our heart, lungs, and the great vessels. Now, there are also other major functions in which that our bone marrow acts as a body's main production center for our blood cells. Now, another major function is the calcium phosphate homeostasis. So, as you know, that our bones act as a mineral reservoir. It means that they store calcium and phosphate in it and they release it whenever it's needed. So, how they are doing so? Whenever a plasma calcium and phosphate levels are raised, so it is utilized in the formation of a new bone. While whenever a plasma calcium and phosphate levels are dropped, they are decreased. So what happens is that our old bone is consumed or it is dissolved in order to fulfill that deficiency. So that's why it's very crucial for us to have a good intake of milk. Now let's talk about the other three basic functions. So these are moving and stability. So basically they allow us to have a balanced posture whenever we are walking or standing. Then the second function is that they help us in moving and storing substances. So basically this function is achieved when a lot of muscles in our body they are acting together, and these systems they also have a specialized muscle which is known as a sphincter. These are the circular muscles. They store substances in the organ for a temporary period of time and they release it whenever it's needed. So the example of these systems that are working on this action are that our GIT moves the food, our urinary system expels the urine, and our heart pumps the blood. Now, finally, also the heat production is the role of muscles. So, as you know, that whenever muscles contract, they produce heat, and this heat is used to warm our body in order to normalize temperature. So, this function is mostly seen in winters whenever our body temperature is decreasing. So we would shiver in order to produce the heat to warm our body to maintain our body temperature. Now let's talk about musculoskeletal examination. But before we discuss the musculoskeletal assessment, we should know what are musculoskeletal disorders. Okay, so let's talk about the musculoskeletal disorders. These are basically the injuries or disorders in the functioning of the musculoskeletal system. So that is in the muscles, in the tendons, and anything that the musculoskeletal system is comprised of. Now let's talk about the causes. So causes are usually multifactorial. It means that they can be caused by the physical factors, psychosocial factors, ergonomic factors, regional factors, or if the individuals are performing the repetitive task, or if they are loading heavy weights. So all of these factors can make the individual prone to develop these MSK or the MSD disorders. Now the common conditions. So the most common conditions that are seen in the MSD are, for example, in the muscle we have strain, cramps. In the ligament we have sprains. In the bones we have osteoporosis. Then in the joints we have arthritis. In the tendon we have tendonitis. So these are the most common conditions. Now the question is why the MSDs are so common. So basically, worldwide, MSDs are so widespread, they are increasing health problem. In fact, the International Labour of Organization and the WHO have labeled it as an epidemic that they should be researched and resolved. And as you know that they increase with the age because our musculoskeletal system deteriorates as we get older, and the severity of MSDs also can vary. So in some instances the pain and discomfort is to such an extent that they can interfere with their everyday activities. That is why the early diagnosis and the early management is so important to ease the symptoms and to improve our outcomes. Now let's come to our musculoskeletal assessment, in which first we have is the musculoskeletal examination. So the basic screening musculoskeletal examination involves the inspection. Here in the inspection we observe for any kind of deformity, any asymmetry, any skin color changes. Then in the palpation, so we feel for any change in the skin temperature, localized tenderness, swelling, crepitations. Then in the range of motion, we find out any restriction in the motion. Then in the muscular strength, which is tested by the MMT, so basically here we observe for any kind of weakness or atrophy or anything. Now, as you know that the musculoskeletal examination is divided into three: the spinal examination, upper extremity examination, and the lower extremity examination. So, first of all, in the spinal examination, it basically evaluates the musculoskeletal structures of the spine, which includes the vertebra, disc, and the soft tissues.